Welcome to the channel of Vet's Corner. Today we shall be discussing about ethnoveterinary practices. Contents are introduction, history, commonly used herbs, common practices in field conditions. Introduction. Ethnoveterinary medicine or EVM is the scientific term for traditional animal healthcare systems. It refers to the traditional folk beliefs, knowledge, skills, methods, and practices pertaining to the healthcare of their animals. There are occasions when animal needs attention for its animal health problem, and expert veterinary aid is not always available harmless, but well tried and authenticated alternate remedies are very much needed by our poor farmers. This has given rise to the concept of alternate medicine or ethnoveterinary medicine. In addition to herbal products, there are homeopathic drugs which have been tried in recent diseases for which effective allopathic treatment is either not available or is extremely cost involving. Advantages and limitations of ethnoveterinary medicine. Advantages. It can be easily administered, mostly given orally or topically. Most EVM products are effective to some extent, especially those with anthelmintic properties. It is cheap and readily available. Livestock owners are already familiar with EVM. Limitations. There is lack of scientific validation of most ethnoveterinary therapies. It is time consuming and inconveniences in their preparation and use. There is only seasonal availability of certain medicinal plants. There is lack of integration with orthodox practices. History. Veterinary medicine as practiced today has its roots in herbal medicine as practiced in prehistoric India, China and the Middle East. It has 5,000 years old Ayurvedic records of Chinese pharmacopoeia and 4,000 years old Sumerian records. EVM are practiced and were practiced as early as 1800 BC at the time of King Hammurabi of Babylon. The identification and acquisition of this knowledge was a gradual process involving trial and error mechanism, deliberate experimentation, observe animal, self-medicate and adopt, communicating and interacting with the visiting traditional specialists of other communities. Commonly used herbs. Aniseed. It is mainly used for indigestion and tympanitis. Castor oil for constipation, indigestion and impaction problem. Asafoetida for colic, indigestion, asthma and chills problem. Acacia mainly for persistent diarrhea and dysentery. Camphora officinarum which is stimulant to heart and brain, tympani, wound, ulcer and sprain. Allium sativum for typhoid, cholera, dysentery and prevent fungal infection, cold and flu. It also decreases GIT cancer, reduces irregularity in gut motility, etc. Azadirachta indica, mainly for mange, boils, eczema, itching, diabetes, ulcer, tuberculosis, loss of hair, pruritus, night blindness, scabies, etc. Allium, Sipa, mainly for insect bites, scorpion bites and other skin diseases. Aloe vera, mainly for wound healing and lowers blood glucose level, anti-arthritic, immunomodulator to any infectious agents. Common ethnoveterinary practices. In case of burn, we can use aloe vera and turmeric topically, which is mainly caused by hot water. In case of teat obstruction in large animals, first of all we need to take a fresh neem leaf stalk, nip it at the required length based on teat length. And then we need to mix it in butter or ghee with turmeric powder and coat the mixture thoroughly on the neem leaf stalk and apply some mixture on the affected teat orifice. We need to insert the neem leaf stalk coated with mixture into teat affected with obstruction, and it will get cured within 7 to 10 days. We need to remember some points for this treatment. Neem leaf stalk should be removed just before each neem milking, and then we need to replace with a neem leaf stalk coated with mixture after each milking, and we need to continue the process till the obstruction resolves. Bloat. Bloat is the name given to the condition when the animal has too much gas and fluid in its stomach. Bloat is a life-threatening problem. Materials required are Khaya Antedica, about 0.5 kg and 3 liter water. Procedure. We need to boil the fresh bark of Khaya Antedica in 3 liters of water for 30 minutes and then filter. And then we need to drench each animal with 2 liters of liquid. Next problem is ticks. Ticks are vectors of several diseases including heartwater, anaplasmosis, and babesiosis. The types and number of ticks on the animals vary during the year. Treatment materials to be collected are Adenum obesum, about 1 plant, and water. Procedure. First of all, we need to crush the Adenum obesum and mix it in water and wash the affected animals with the preparation. Diarrhea. Diarrhea is a common disease in newborn animals. Diarrhea is also a symptom of other diseases such as rinderpest, heartwater, and worm infestation. It is very much important that animals with diarrhea have enough water to drink to prevent dehydration. Treatment of diarrhea mainly caused by intestinal worms. Materials to be collected are Zydium, guava, about 0.5 kg, and ginger, 50 gram. Procedure. 50 gram of ginger and 0.5 kg of tender leaves of Zydium together and make 1 bolus of these materials. Make enough boluses for all animals to be treated. Give 5 or 6 boluses at a time to a calf. To prevent and treat dehydration, drench calf with a large volume of water mixed with salt in the ratio of 250 ml of salt to 5 liters of water. Drench half a liter 4 times a day for 3 to 4 days, and it will get cured in a very short time. That's all. Thank you.